Hi, my name is Lucia. I'm a third-year internal medicine resident from the General Hospital of Saltillo, Coahuila, Mexico, and today I'm going to present a case report of a classic Kaposi sarcoma. As an introduction, Kaposi sarcoma is an angiogenic neoplastic proliferation that requires infection with human herpes virus 8, but only a small percentage of infected people will develop the disease. 4 clinical variants are recognized. The chronic or classic one, which typically presents in people aged above 50 years old. The African endemic one, Kaposi sarcoma due to iatrogenic immunosuppression, such as people being in treatment with steroids, and the AIDS-related form. The role of immunosuppression is a well-described risk factor in all types of Kaposi sarcoma, but more subtle degrees of immune suppression may be present in the classic form. Classic Kaposi sarcoma is rare and more common in men of Jewish and European descent. Because of multifocality, treatment with chemotherapy and/or radiation is favored over surgery. As an objective, we will report a patient with classic Kaposi sarcoma evaluated at the internal medicine consult. So, a 78-year-old male from Mexico presented with edema in the distal lower right extremity with pink to violet and livid nodules that coalesced to form plaques over the last 4 years. He had a history of being electrocuted with the current point of exit being on his right knee. He also had a history of long-standing diabetes, hypertension, and chronic kidney disease stage 3. Biopsy specimen concluded Kaposi sarcoma, and immunohistochemistry showed nuclear staining of human herpes virus 8. Serology for HIV was negative, and normal laboratory findings confirmed the diagnosis of classic Kaposi sarcoma. Chest and abdomen CT did not reveal dissemination of the disease. Treatment with pegylated liposomal doxorubicin at a dose of 20 milligrams per square meter was initiated. As a conclusion, we can say that classic Kaposi sarcoma is a rare neoplasm, and only a few cases have been reported in America, especially in Peru. It is a diagnostic challenge, especially in this variant. The antecedent of electrical burn in this case may have been a possible contributing factor, besides the history of immunosuppression, such as the history of diabetes and hypertension. Thank you.